Hello, my name is Ben Kaner. I'm Chief Technology Officer for BT Global Health, part of BT Global Services. And today I'm going to be talking about big data and its use in healthcare. Big data, is it healthy? So for those of you who don't know, and some of you may or may not, BT does have quite a lot of activity in delivery of healthcare systems. We have some major health programs we've been delivering for the NHS in the UK, including, of course, the NHS network, which you could see as being part of our core business, but also delivering acute community mental health systems and PACS, imaging systems, across the London and across the south. That means the major things like Barts in London, you may walk past just north of here, the big trust like Imperial, they use systems that we have provided and delivered. The major national systems, the core messaging, summary care record, master patient index, and most interestingly in this context, secondary uses service, which is the major store of data which is used for analysis and planning across the NHS. So we actually have been a major player. This has been over the last 10 years, and we have successfully delivered against all of those contracts, which is a unique record, it has to be said. And it's been a struggle. It's very, very hard work, but it has been done. So I'm taking a slightly different tack on this, so no apologies for this, but I think it's just worth re-baselining the context in which we're having these discussions. So the first question is, why is more data better? We say big data. What is big data as opposed to a spreadsheet you have on your desktop, or even a data warehouse? Variety, velocity. The sources of data are bigger, they're coming in faster, there's more versions of it, and there's more ways of analysing it using big data techniques than you could previously. Hence the cost of data warehouses being very high, relatively slow compared with big data techniques. But we do assume that more data will enable us to detect faint signals in the data, whether it's unhappy customers for a particular reason or whatever it happens to be. They may be correlations that we haven't previously noted, or patterns we haven't previously noted, or may be able to make service more personal. Again, those marketing things that was being referred to earlier. But data is only valuable when it differs. It's the differences that you're analysing. Similarities are, to be honest, it's like having a wall painted in one colour. Okay, but a picture has detail. So the more uniquely identifiable, the more valuable. So, going with that, spurious correlations are inevitable. They are inevitable. If you have 100 million possible ways of combining your data, then at least one of those combinations will have a chance, and it will be completely spurious, will look like it's got a chance in 100 million. That's just basic stats. So what is this? I mean, this is a case of correlation. It's a 99% level correlation between US spending on science, space and technology and suicides by hanging, strangulation and suffocation in the state of Maine. I think there's a relationship. What do you think? But if you, it's from spuriouscorrelations.com, you can go and look up. They've got lots of fun ones on there. Given the scale of big data, spurious correlations are inevitable. The medieval process is act on the basis of the story of the correlation without testing it. The authority approach, and this is what actually the authority, the good book, or whatever it happens to be. The scientific approach is look at the hypothesis, then attempt to disprove it, and then treat it as tentatively acceptable until you find more phenomena which may disprove your hypothesis. That's the scientific approach. Which are we doing at the moment with big data? Interesting. In advertising and marketing, testing is by doing. It's the medieval approach. It's great, particularly if you've got a medieval approach, but almost a medieval feudal approach to your market, because you've got control of what they see on their screen every day. Look at Google and Facebook, and what comes up is what they control, and they vary it to suit their marketing and their presentation, and they get better customer experience, they get the results. Test by doing. Having all the hypotheses is great. If you could do, it's cheap to test in that way. Doing it that way may not be acceptable for clinical treatments. I'm not sure I'd really want my leg cut off just because somebody thought it might be a good idea. Second question. What data? Here's a set of classifications of data. Government-sensitive operational data, anonymized personal data, sensitive personal data. We were talking about these classifications in the previous presentations. So, what have we got? Freedom of Information Act says public publicly collected environmental data, some of the stuff that you've been using in your systems in Italy, drives your ability to access those data because it's collected by the public on the public's behalf. However, sensitive personal data, at the other end of the extreme, is protected under the Data Protection Act in the UK and EU Article 9. There's a stress there, because big data goes across this piece. Commercial organizations don't usually publish their internal operational data. It's sensitive, commercial in confidence. Interestingly, however, our lives on Twitter, we seem to have no qualms about publishing our entire lives on social media. And then, of course, our propensity to buy is analysed from that behaviour, and that propensity to buy is sold to advertisers, and that what becomes the commodity that is traded. Artifacts in data collection will lead to spurious patterns in the data. And if you exclude data or certain sets of data from the correlations, then you will create artifacts. And of course, commercial in confidence for commercially internal operational data, government operational data tends to be restricted. We've got DWP data and the like. And sensitive operational data, well, of course, we don't talk about that unless one or two people in the States may have exposed a little of that. And it has caused interesting eruptions. But a lot of data science is compensating for that. So open data, as we've discussed, the traditional open data and big data, it's the public collected environment data, anonymous personal data in certain circumstances. Care.data had issues with this. Shared data between organizations, commercially traded sensitive data. If you can get a market going in that, then there's actually quite a lot of power, and people may allow them to share personal data if they can see a return on it, which is where the telecom Italia have been coming from. Unshared data, usually, is sensitive personal data, like your health records, specifically protected under EU Article 9. Commercial organizations don't tend to share their own data, and if they can avoid it, governments try not to share their sensitive data. So they're different classifications of data, yet big data is broader and more valuable, the more identifiable. The more you're at the top, the more valuable that data, yet the more difficult it is to share. So you've got a conflict. So I'll give you an example of one of the things we're doing, which is in the bottom to middle of those tiers. So healthcare and commissioning care services across an environment is hard, because you want to know which patients present the greatest risk, or should we be providing more clinics or more training? How can you monitor patients' experience? These are all big data questions for internal use. It's the traditional forms. You've seen some of these used in telecoms providers, and we do it. We use social media and track the social media using various mechanisms to find out who's not happy with their service and see if we can react quickly to that and all those kinds of things. That's internal use for BT. That's not to do with healthcare. But if you're trying to pay for improvements, you've got to track those, and big data gives you a way of doing that. But how do you get access to those sources? So what we have is a system called Open Insight, which creates a data hub which has open data sources, communities of interest, application development partners. We can't do it all ourselves. And between that, we have a data hub which provides into an applications portal into which the customer's own data can be pushed. So it's not just external data, it's your own internal data, which gives the boundary between the open and shared. And then that creates visualizations of various descriptions. And all of us realize that if you're trying to spot patterns, computers don't spot patterns, people do. People spot patterns usually on the basis of visualizations. So you get a nice big picture, you start sorting through it, and say, oh, that's interesting. And it's a difference in the way that data is presented. So presentation is really important. You cannot expect any one organization to have a monopoly on that. The more ways of looking at information, the more value you will be able to get out of it. So that's one of the ways in which we're doing it. It's just one, but it's one. So the next stage, I'm trying to make sure this is quite fast because I'm between you and the panel discussion and then lunch. So maturity in the use of information. This is a maturity approach we use across the use of information in healthcare delivery. This is not about big data, analytics, just the slide down here. But clinical services, this is about clinical systems like the systems we provide in the NHS, corporate services. A hospital, or CCG, is a big organization, very big organization in some cases. there would be FTSE 250 companies in many cases. 10,000 employees is not uncommon. Facilities management is a complex beast when you've got multiple sites and very specialist services, and so on and so forth. These are all activities that happen. But the level of maturity is really quite interesting, because when you actually go and look at it, it says, okay, you've got point systems or paper-based request and fulfillment. That's very basic, but it still happens in the developing world. Notice it's global health, it's not just UK. The current global leading edge of attainment, we feel, is around here. So yes, you've got complete electronic medical records, but facilities management is rarely optimized as a service. Patient experience is, yeah, you provide web services and things like that to your patients, and maybe some web experiences, but it's not integrated across all your provider services or integrated to the home. It is in some rare cases, but it's not very common. We are actually providing this service, risk stratification service and assisted living services and telehealth in Cornwall in the UK. It's rare. Normally it's basic telehealth services in most countries. Information security, information risk strategy and a ISO 27K security management system. Very rarely is that implemented fully and consistently across organizations, because most people find it difficult to understand security. They see it as a barrier. Actually, it's a necessary enabler of doing this at scale. Interoperability is the ability to take information from multiple sources, but your multiple sources have different regulatory controls over what you can expose and different consent mechanisms. That's hard to manage, and so it's actually very difficult to do across a wide field. So again, global leading edge is starting to get the health economy, health information exchanges in the States, and we're doing some of those in the UK as well. Collaboration optimization across multiple providers is starting to happen at what they call the clinical commissioning group level. But it hasn't happened as much as it should. It will happen more. So the extending is when that becomes driven by remote technology and across a multiple health economy. What we call full maturity is when the system reverses and it's oriented around the personal view of their data. Again, harping on about the Telecom Italia theme, which is quite neat to have that referral back, is when people see the system as supporting their outcomes rather than the patient being served at the gift of the system. It's a very different concept, a very different philosophy. But we believe that both the E and F levels, they haven't been reached yet, but they will both be extremely disruptive to health systems worldwide. So taking analytics specifically, ad hoc local information, basic and complex levels, is local information. This is just defining what we mean by those analytics levels. But the interesting point is, information fully pervades about the patient who can interact directly with the resources they need to maintain health. That means the information is in the power of the individual. Doesn't necessarily mean to say that analytics is being done with their private data. They're matching themselves against some public data. But traditional analytics covers the bottom left. It's basically organizational stuff. Shared analytics, which is starting to come through now, requires sharing against a regulatory regime and has much more value, but it's not really big data. It's actually still shared. It's still traditional analytics in many ways. Big data analysis is when you can have strategic and managed across all the way down into the community in a dynamic form. We're not ready for that yet, as we don't have the infrastructures with which to do it. We're working there, but it's not there yet, which is why is it in the hype cycle? It's in the early stages. We'll get that. And finally, this sequence is about making this work on a broader scale. An information economy requires a structure. If you're going to have an information economy, it's a market, it's an economy. Market implies trade. Currently, you don't trade data. It's done internally with organizations as a vertical integration. This is like Ford in the 1920s owning their entire supply chain cycle. Well, actually, Google and Facebook still do. They collect your data, they analyze it, they monetize it, and they use it for improving their customer experience, but their money is generated for all the way through from data collection to data presentation. They are a vertically integrated industry. Most industries have gone past that vertical integration and now have a trading platform. All the telecoms players do. If we had tried vertically integrating in telecoms, it wouldn't work. So, to do this, we need a data plane tied to permitted use at point of origin, so you know who the data is from and what consents you're offering. Remember, I'm coming from the healthcare side. This is very sensitive. So you take that plane, you need to be able to ramp that in and share it and trade it per its consent. but the tagging must be maintained through that trade, not currently a technology that's available. So in this case, this was about health, so it's central government, health ministries, insurers. Do you want to share your personal health records with your insurer? Well, you have to get treated, but you may not want to if it means you're at risk. And who's pushing liability where within the system? But that exchange plane has to be able to be traded so that they can actually generate their information. So the traceable and auditable. So to be traceable and auditable, you need to be able to tag the data, but you also need to know who is requesting access, which acquires identity. Who is going to ask for access to the data, and are you going to give them the rights to it, is a double question. Both need to be answered. Do we have a federated IDAM capability across healthcare, not just in one country, but multiple countries? Answer, no, we don't. When's that going to come? The internet does not have an identity layer. Well, if we could have an identity layer, then this starts to become possible. Until that point, it's going to hit stalling patterns all over the place. But if you do have that, then you can share and test your algorithms across all the data to which you have the rights, or which, it could be scientific across multiple areas. Much freer movement of data, much more creation of value from the bottom left of benchmarking through to personalized healthcare. This is healthcare one, but you can imagine the same one in smart cities, the same kind of thing happening in telecoms environments, in marketing environments. What data can I create? What value? But if you do find value, you can trace it back to the originator of the data and pay them for the value created. So instead of having to keep all the value, you're starting to trade value through the system. Now, a trading market across the whole of the European Union is a much more efficient way of creating value for lots of players than a vertically integrated market. It'll share a lot of the economic benefits across a much wider frame, and that, I believe, is a good thing, and telecoms players are in a good position to be at the core of that. And finally, so if you've got that, the individual can match their data to the available patterns and algorithms that's generated, and to inform your own individual decisions. Great, you've now made it a data democracy in that sense. So that's the information economy. So to conclude, there are different approaches. Currently we are on the vertically integrated players. Consent is agreed to on the basis of a provision of a useful service. We've discussed this already. Abstracted on the basis of use of service, and maybe other sources. They discover, those integrated players discover the signals. It might be BT discovering the signals about use of our own network. It might be Facebook about your propensity to buy, whatever it happens to be. But there's a lot of CPUs involved. Sell propensity to buy, and then personalized service, which closes a loop. It's a closed loop. It's not an open loop, it's a closed loop. Public and healthcare now, specific consent, very difficult to obtain. You should see the trouble we had with Spine. The data assembled between different organizations, called the Guardians, Data Protection Act, ethics committees, governance, all these kinds of things prevent easy sharing of data. And quite rightly so. It's sensitive, thank you very much. When you can do it, you can search for signals, you can use data for planning inefficiencies, and you may be able to get a possible improvement in services. It's a bit stilted, is my personal opinion. In information, data has structured consent at the point of collection for whatever purpose. People expose that on the basis of good citizen, different purposes, research, benign use, whatever it happens to be. But they also have the ability to control and restrict that. Data can be assembled in line with that consent and brokered, different assemblies, different values. Wide variety of approaches. Wide variety of approaches leads to more innovation. More innovation leads to more value. Not all of them are going to work, some of them will. And then you can ability for the individual to match themselves, so you can actually exploit that value all the way back down to the individual level, not at the gift of the data provider. I think that last column is where we want to get to, but we're not there yet. So, finally, the information is currently dominated by a small number of vertically integrated players, and we as telecoms players do use that information internally for our own purposes, but that's a relatively small proportion of the total value available, or the value of that data, if it was brought together. It's inefficient, I would say. Don't like inefficiency. True information economy, we're going to have making a control auditable market. Yes, you can have enforcement regulations, you can have punitive regulations about the use of data, and data regulation in the EU is pushing that way, but you need to be able to enforce it. Whose fault was it that that data got exposed? So to do that, I believe you need separation of concerns. So collection, assembly, transmission, exploitation are separate concerns. Currently in vertical integration, that's not the case. If you can engineer analytics of sensitive data with that consent handling, you're ahead of the curve. We do have experience in this. That experience is relatively rare, and we intend to be able to use that in the future. And my final comment is telecoms markets ourselves, do have the correct structure and market position to enable this market. Haven't got there yet, but we are in the right place. Therefore, this is really exciting time to be in this field, and we're in the right place to do it, and we can do an awful lot with that position. Thank you.